Hi, my name is Guillaume from Physiomentum. Today we're going to show you an exercise program for post-op ACL and meniscus surgery. First thing to do will be to remove the Zimmer brace that the hospital provided you with and the bandages around the knee. There's going to be three purposes for this ACL post-surgery program. First will be to keep the blood circulation in the leg properly. Second will be to restore mobility and start waking up the muscles in the leg. First off, for blood circulation, we're going to ask our patient to do ankle pumps at the ankle. Just like this, to create a pumping effect in the calf and to avoid having some blood clot in the area. We do that for about a minute, and it can be repeated throughout the day as many times as you want. Secondly, we're going to work on range of motion of the knee in extension and flexion within limits of pain. For extension, we're going to ask our patient to push the knee down slowly for about 10 seconds. And we release. We do that about 10 times. This can be done about twice or 3 times a day. For flexion, we're going to use a towel as such, or a belt, or an elastic band. We're going to put it over the ankle, or around the ankle, sorry. And we're going to ask our patient to pull slowly, again, within normal limits of pain. Usually 90 degrees is a maximum that you can get in the first week after the ACL surgery. We hold it for about 10 seconds and then we release. To be done again 10 times, about 2-3 times a day. Next, we're going to start working on muscle recruitment by doing some isometric exercises. We're going to work on the quad and the hamstring. In the case of the quad, we will ask the patient to flex the quad, just like this, and hold a contraction for about 10 seconds, also to be repeated 10 times. It's basically like you want to push the back of the knee into the towel. For the hamstrings, we're going to ask the patient to bend the knee just a touch, like this, about 30 degrees of flexion, and we're going to ask them to push with the heel down into the table, contracting the hamstring muscles in the back. Also to be repeated 10 times for 10 seconds. Another exercise that needs to be done is the active straight leg raise. In this position, we're going to ask the patient to contract the quad again and to bring up the leg about 6 inches off the table. Hold this contraction for 10 seconds and repeat 10 times. If it's impossible because the leg is too weak, focus on the one that we showed you previously, meaning the flexing of the quad into the table. For the next 2 exercises, you're going to need to put the Zimmer brace back on. We're going to start working on the inner leg muscle and on the glutes muscle. For the inner leg, you're going to put the other leg in a bending position like this, and you're going to bring the injured leg up and down. Do not hold this exercise. You basically just go up and down for about 20 times and repeat 3 sets. For the glutes muscles, also with the Zimmer brace on, you're going to try to bring the leg up this way and down. Also for 3 sets of 20. This concludes our exercise program. Please note that you should be following a physiotherapist for the rest of your rehab. This is Guillaume from Physiomentum.